All right, so I'm going to take you over to our counselor's office. He is fabulous. We're excited to have him. He really does great work for our patients. So this is his office here. Again, it's very soothing space because that's what our patients deserve. Some good lighting, fun things to squeeze and press, and he helps people with all sorts of challenges, emotional challenges that they're going through, as well as offering counseling support for people that are suffering from more severe mental illnesses. So we'll head on over. So again, we do have a large number of exam rooms. We do have a bathroom, and we do take urine samples and do tests on urine. So more exam rooms. I'll lead you over to our psychiatric nurse practitioner's office. She's right here. And again, it's a little homier in this room than the more, clean, sterile environment of our clinical space. There's a carpet. There's a couch. It's supposed to be more soothing, more comforting, without the clinical vibe. All right, I'm going to take you on to another room. It's where our occupational therapy and music therapy takes place, and this is with partnership with Shenandoah University. So you'll see there's some instruments from one of their sessions, but we are very lucky to have an amazing relationship with Shenandoah University. Professors come out and they teach students while offering really high quality services to our patients. We have physical therapy that comes out. They work downstairs. We have music therapy. We're actually a space for somebody doing research around the therapeutic merits of songwriting with the homeless population. And we also have occupational therapy that does a lot of the mental health work as well. So we're very lucky to have such strong partners within Shenandoah to have even more services. On top of that, we have clinical pharmacists that help with our complex patients, especially with all the tons of medications that they have to take, and making sure that there aren't too many and that the patients understand them, especially around diabetes. So we have our clinical pharmacist who volunteers here, Jamie Huff, and she brings students. So, it's a really good relationship that expands services and creates the next generation of leaders in the community who are going to leave here with a soft spot in their hearts for the great work free and charitable clinics do and for what they provide to the community. So we're very happy about being able to be part of that training. All right, moving back on out. And that's pretty much this clinic space here. A few things I didn't show you. We recently brought in Valley Health's partnering with us to do on-site phlebotomy services. We found it was really hard for some patients to travel the mile plus uphill because a lot of our patients might not have cars or reliable transportation to get those labs done. Yes, we can get them done without any charge to the patients, but they were really struggling with just getting there. It was a barrier to care. So we worked with Valley Health, and Valley Health's come out and helping us do lab draws Mondays and Fridays, which is huge for our patients. So I brought you outside of pharmacy services. So again, we are open to the community. We just do not charge insurance at this time. So we do, our pharmacy staff is incredible. They know patient assistance programs inside and out. They are hooked up with all these other nonprofit organizations whose mission is to make sure that people who need help affording medications get the medications they need. So take take diabetes medications, for example. Any idea about the average wholesale price for diabetes meds? Any guesses? Okay, think about the number in your head. All right, it's anywhere, the average wholesale price, so this is what CVS or Walgreens buys. It can range anywhere from $400 to $1,200 a unit. And a unit can get you through maybe a week or up to 2 months, depending on your medication needs. And for people who are living paycheck to paycheck, people who don't have $1,100 just sitting around in their pocket, that's impossible. And their health, you need your meds, you need treatment in order to live and to have a healthier life. So that's what our pharmacy does. That same diabetes medication, we can give it to them and ask only for a $5 donation. That's huge and life-saving for these patients who just need a little more help. So our pharmacy services are incredibly important. We actually had our pharmacy staff, they get to know our patients really well. They get to talk with them, help educate them about their meds. And so sometimes when our patients leave them because they get Medicare, they still call and they still ask for help. We had one patient whose medication her Medicare, she didn't pay the premiums on the Part D and it lapsed, and she went over to a local retail pharmacy and they said, well, that'll be $1,300, please. Your Medicare is not working. And she panicked. So she called over to the pharmacy staff and said, hey, I don't know what to do. I need my meds, but it's $1,300. Can you help me? Can you tell me what I need to do to get them? So they ran it through and they ordered the meds and they charged $18. I kid you not. So for somebody who needed some help, $18 for a $1,300 med. I mean, the work we do here, it's incredible, it's life-saving, and it just dramatically improves people's quality of life. So I'm very, very lucky to have such a strong and devoted staff. Both Brandy and Maureen here in pharmacy are just amazing and so patient-oriented. So I'm glad that we got a chance to tell you about the pharmacy services we offer here.